I'm Dr. Bill Lawler. Good to be here with you tonight. Some of you are patients in my practice in Alpine, Utah. Others of you may have found our YouTube channel some other way. We welcome you. I am a pediatric and family chiropractor, and I have been practicing for a long time, about 38 years. Tonight, we're going to talk about one of the things that I like to talk the most about, and I want you to think about how you believe what you believe about health. So our topic tonight, and I know this is pretty small, we couldn't figure out how to put it on the big TV. So anyway, why do people get sick? Lots of different reasons, lots of different thoughts. We live in a society of Western medicine that talks all about that it's got to be from something on the outside. It's the germs, it's what's around us, and that's one idea. Is it in fact from germs? Is that what makes people sick? One of the questions when people say that, one of the things that I always wonder about is, okay, within a same family, why do some people get sick all the time and other people seem not to get sick? There was a fascinating study some 30, 40 years ago about Siamese twins that means that they're conjoined and they have not been separated. One was relatively healthy, the other one was not. And what that actually looked at was what factors were going on in one of the two twins' bodies versus the other one. But is it from the germs? Why do some people get sick? Why is it the external environment or is it the internal one? And that's where really I want to spend most of the time tonight, is talking about what is happening that's making someone's health go from good to not so good. And yes, there are some genetic factors, and I didn't include that in this. We're talking about outside of genetic factors. What is it that is the biggest influence? Is it environment or is it the host? So here we go. What are some external factors that are very real? Bad air, bad water, germs we have here. I've done this same workshop now for over 3 decades. And whenever I ask what are some reasons why people get sick, somebody always says germs. And I'm not saying that's not entirely true. I'm saying that we're going to examine that tonight and say, is that the major factor or is that a minor factor? Obviously, COVID right now, this is November of 2020. COVID has been running rampant since March, and that certainly is a virus type of germ. And is that the major reason why people are getting sick, or are there other possible reasons as well? Poor hygiene is another one, bad water. All right, so now let's take a look at some internal factors. On not enough sleep, that actually I should have written down quality sleep, because even if you get 10 hours of sleep, but you're not sleeping well, you've got a bad mattress, a bad pillow, your mind is full of things, you're not really getting a deep level of sleep, that's not so good either, and that's not an ideal place to sleep, is on the keyboard. Not enough water, poor nutrition, exercise, not enough exercise, bad attitude, poor relationships with others. So those are all internal things that we have more of an internal control over than just the bad germs out there in the universe, in our homes, in our offices, or in our playground, or wherever. So internal factors, external factors. So there actually is, we live in a society, we live in, this is the United States that I'm doing this from, and we're very much a Western medicine approach, which means we look at what's happening from the outside. We look at what the symptom is saying, and not necessarily why the symptom is saying that, but just what is the symptom and what can we do to get rid of it. So outside in, we looked at the factors that cause the disease or illness or sickness or lack of proper health being an outside thing. And then the cure, we also look at the same way. We say, well, we're going to look at a couple symptoms in a minute. So how can you, one of the questions and what we're pretty obsessed about right now with COVID is what can we do to decrease the negative outside your body factors? There's hand sanitizer everywhere. Went to church today. People were putting it on before, during, and after. Wearing a mask, all these outside factors. And again, I'm not saying that any of those are not real, but that's the outside in approach. Now let's take a look at the inside out approach. There used to be a chiropractic college called ADIO, above, down, inside out. That's where we believe that healing comes from. That how can you strengthen the host or the innate intelligence of the body? That's where chiropractic our philosophy goes there. That's what we believe is the strongest part of what we can do to be of help to our body and to our health. So let's take a look at that. All right. So I've always done this, and again, this is a class that I've done for many, many years in my office. Now that we have COVID going on, we don't have meetings in my office, but we always ask, what are some common symptoms? What are some things that everybody gets? And let's take a look at whether we look at an outside-in approach or an inside-out approach. So, headaches. They're like 80 to 90% of all people get headaches, sometimes extremely frequently. The other day, I just had a new patient come into the office and came in for a variety of things, back pain, elbow things, different things, injuries and so forth. And then as soon as I touched his neck, I said, "Oh my gosh, do you get headaches?" He said, "Well, yeah, as a matter of fact, I do." I said, "Well, you didn't tell me." They said, "Well, it's just part of my life." So some people get them so much that they don't even talk about getting them because that's just their normal, which is very sad and unfortunate. But if you get a headache, what's an outside-in treatment? Well, everybody knows that. Pick your favorite painkiller, whether it's Tylenol, ibuprofen, Advil, Excedrin, aspirin, and the list goes on. So some kind of a painkiller that gets in there, blocks that pain signal, hasn't really done anything to the headache other than it's eased that pain. So that's an outside-in approach. Same thing with a cold. If you have a cold, what should you do? Outside-in approach, you can take some kind of anti-decongestant. You can do things that help dry your nose up. You can do all kinds of rubs. You can do lots of different things outside in again. So what would be a possibility for those two for an inside out approach? Well, if I had a headache, my approach has always been, why do I have a headache? What do I think I did? I play a lot of tennis in the summertime, and if I do not have a hat on to shield my eyes from the sun, if it's a really bright day, I even have sunglasses on. If I do have those things happening, then that can dramatically affect how my body is responding, and that gives me a headache. So it wasn't my head's fault. It was my own fault, and then I need to do something differently. I may not be having enough water. I might not have got enough sleep. I look at internal factors of what responsibility can I have other than, oh my gosh, I got that stupid headache. If you get a cold, that's not the end of the world, and a lot of times change of season. Right now, I'm in Utah, and there's probably about 4 or 5 inches of snow outside. Change of season. A lot of people are going to get colds this week because it's gone from fairly warm to not so warm. So, and again, the natural approach to that would be taking vitamin C, drinking lots of water, getting lots of rest, helping your body with echinacea, different other things that help your body's innate intelligence and immune system work better. Okay, I put in highlight here, and I don't even know if you can see that, but fever. Fever is where the rubber kind of meets the road. Fever is where we separate the men from the boys, the women from the girls, the wheat from the tares, whatever metaphor you want to use. You have to say, first of all, why does somebody get a fever? Is it a good thing or is it a bad thing? Is it something we should freak out about, or is it something that's actually very natural? One of the most common things I always ask is, if you're outside in the wilderness and you're camping and you've run out of your water, your choices of purifying water are you have a water filter, you put something in the water to clean it out, or you boil the water. Boiling the water raises the temperature, gets rid of the impurities and the germs, and then the water is more pure. So fever, 95 to 99% of the time, is something that's actually very good for the body. The body's trying to get rid of something. If we jump in with what's called an antipyretic, same cure for headache and all kinds of other things. Taking Tylenol, taking something that lowers that body's temperature, you're kind of fighting against your own body's ability to fight whatever it is that's going on. Now, that 1 to 5% that it's something more serious, then it's something more serious. You need to look at that and figure out what's going on. Ear infection, what are some cures for that? You can take a drug. You can do some natural drainage things. I have a whole workshop just on how to help kids with ear infections. I'm not going to go into great detail, but there's a natural approach inside out, and there's external, of course. And you can put holes in the ears, you can put tubes in the ears, you can do all kinds of stuff. If your stomach's upset, what I love about this is there's old commercials It shows a guy at a bowling alley. He's eating a bunch of pizza. He's eating a bunch of hot dogs. He's drinking soda. He's eating potato chips. And the slogan actually says, if you are going to eat a lot or something like that, don't worry about it. Just take us with you. So it's some kind of an antacid pill. Well, I say the guy deserves a stomach ache because he ate a bunch of crap. And so therefore the body's telling him, hey, I don't really like this. You're making me mad, and not just covering it up again. So then all kinds of other things, fatigue, drowsiness, they can be things that we can take a pill for, or we can try to figure out why aren't we sleeping as well as we should be. All right, immune system function. The real underlying thing that makes a person healthy or sick is how well their immune system functions. So now you again look at internal factors. What are you doing to help your immune system function better? What are you doing that can help your body be healthier? And again, we look at things like nutrition, exercise, sleep, managing stress, having good hygiene, having good relationships. And of course, I wouldn't be doing justice to my profession if I didn't say chiropractic adjustments. And they actually help a lot. Two, number one, things that we actually look at to boost one's immune system is to relieve the body of subluxations. So here we go. Improve the body's immune system. Yes, it does that. Improve the body's function. Yes, it does that. Get adjusted. Decrease the damaging effects of subluxation. Works on from babies to toddlers to teens to old people, to adults to very, very old people. So subluxations, that's the key. And what is the subluxation? In case you don't know and you're looking at this, it's when a vertebra gets misaligned in relationship to one above or below or both, and the body doesn't have the ability to realign it. This person's got a very weak neck. So getting that readjusted helps the body function better, gets pressure off the spinal nerves, spinal cord, and therefore can improve function. Chiropractic has 33 principles. I'm going to go over two. They're my two favorite. The wellness approach to health. Number one is there's a universal intelligence in all matter, all around us. So whatever is living, it has the universal intelligence inside of it. It continually gives to it its principles and actions, thus maintaining it in its existence. I also call that God. There is we believe a deity, a God purpose that is helping everything work, the trees, how many times the earth spins, gravity, all the different things that are out there that are way more complex than I could explain. And number two, my favorite, is that every living thing has an inborn intelligence within its body called innate intelligence. There's an intelligence inside my body. There's an intelligence inside your body. When you bring your baby in that's either a day old or 2 weeks old or a few months old, what I'm really trying to do is just get out of the way and help that little baby's intelligence heal itself. Get rid of some interference. Get rid of that hyper sympathetic nervous system stuff and get the body to calm down. But we're always trying to get after that innate intelligence. So here we go. Final slide. What should you do? What's going to be something that you can do for yourself? Well, first of all, think about what you could do better. Eating better, sleeping better, getting more water, doing more exercise, having better relationships, doing things to decrease your stress. So what I boil it down to is, what's the very best thing you do for yourself? Well, do more of that. And what's the worst thing you do for yourself? Well, stop doing that or decrease doing that. If you're doing too much caffeine, get more water. If you're not sleeping well enough, try to work on sleeping better. No one's going to do it for you, and it's our responsibility ultimately. If you're not eating well enough, if you're having bad relationships, whatever it might be, identify the best thing you do, keep doing that. Identify the thing that you actually are not doing as well as you should, and do something about it. Take action. We believe totally in the body's ability to heal itself. But in order to do that, you have to help that along. You need to make as much of a difference as you can to your own health, and you need to help yourself be healthier. I totally believe in the body's ability to heal itself. I've seen it not millions is probably an exaggeration, hundreds of thousands for sure, in my own family, in my practice, all around me, in my profession. And I'd love to entertain any questions you might have about this. Inside out versus outside in. And inside out has worked for me and my family of 6 kids and 12 grandkids. And I hope that it'll work for you as well. Thanks for listening.